Hello everyone, and thank you all for being here. I am here with Dr. David Ellsworth, and we are going to be talking about the COVID cases and specifically what David as a doctor is seeing. Currently, as of today, according to sources from the New York Times, Wikipedia, we have had a total of 96.2 million cases with 2.06 million deaths worldwide. Specifically to our area in Clinton County, we have had a total of 2,317 cases and 18 deaths. So David is a practicing doctor in the Clinton County, and I'd like you to introduce yourself, David.
Well, hello. Tom and I have been friends for quite a long time now, and appreciate him, having me come be part of this. I guess just from disclosure standpoint, I have no skin in the game in anything. There's no disclosures, no financial issues here. I'm kind of representing myself privately. Anything I say today, it's not affiliated with the company that I work for, or the health network, and take everything I can say potentially a grain of salt. I'm not an expert on infectious disease or virology, but as a physician, I'd like to think I have a more knowledge on it than the average bear. So,
yep,
there it is.
For sure. Because you are at the front lines essentially with working in the medical facilities. So, can you tell me what are you seeing in terms of the COVID pandemic and your work environments?
Well, it's interesting. Just getting out of residency a year and a half ago, I had maybe about 6 months of regular practice, want to say, but that's still like learning how to use the EMR, the patients, the system around here, referrals, things like that. So I haven't actually had like a full year's worth of even getting into it, because about 6 months after I started, the pandemic hit around February, March last year. So it's changed dramatically, because the first couple of weeks when we were doing stuff, we had no idea what the heck we were doing. It was basically like, this is a pandemic, it's a big deal. So we were kind of trying to risk stratify kind of everybody and say who really needs to come in, who needs to get seen, and who can we push out. So for like a couple of weeks, we were like, all right, because we'd heard that mortality rates are larger in people that are older than 60. So we kind of was like, all right, people less than 60, could potentially come in, do telehealth or whatever it is from that. If you're higher than that, if you need an annual wellness visit, that could be pushed out. Things like that weren't really medically fully necessary. We were like, all right, push them out a couple of weeks and hopefully we pass this. Well, clearly that wasn't quite the case anyway. And then we realized that we had to be like, after a while, because, numbers down, you're still need to see patients meet numbers for everything. And it basically changed the way we really practice, because everything that you think about, like normally, like it's winter months, people have colds, or people have allergies. And the thing is, lots of symptoms of COVID made it much more difficult to differentiate. So risk stratification came. So, people, when they first call to make appointments, you'd have to ask them all these sets of questions that we still are doing today. And they've been revised over and over, because as we've realized over time, that some things are specific much more for COVID, such as, loss of taste and smell is rather particularly, not saying other viruses can't cause it, but it's a big hallmark kind of a sign for it, especially if fever, cough, shortness of breath, things like that.
For sure.
So I guess the issue is that we've had to really put extra effort and a lot more time into even saying who can be allowed in the office and who should be seen over telehealth appointments. And what's interesting is that over the last year, really, we've seen a ridiculous explosion in the amount of telehealth visits, whether that be telephone or televideo. Now, reimbursement, makes one thing more desirable than the other for sure, but at least it's a one-way. Those are ways that we can communicate with people. That if you're going over labs, or there's certain things that you don't need to bring into the office, where you have to say listen to heart or lungs, or you're an older population, you don't know how to use any media, which is understandable for that standpoint for that. So it's actually really changed medicine for the time being, and it's interesting going forward. What's going to happen with that? Because when you think about it, sometimes people even like that. Like, say you're prescribed an antidepressant for any reason, and now you're like, well, I need to come to the office. It's really just going to be talking kind of stuff. And if people feel comfortable at their house just doing it there, I don't see a reason to bring them into the office if we don't have to. And but the big thing that's going to push that too is billing and reimbursement. So the idea, if say after this pandemic ends and telemedicine, still going to be a thing, but then the insurance companies or whoever it is are saying, well, you're not going to get paid for this at all anymore because the insurance companies, or at least were allowing this, understandably so. Well, what are they going to do? But at the end of the day, you still need to see people. You still need to make money to have your network and practice continue to go forward, right? So it's going to be interesting what happens after all this ends. But I think honestly, there's going to be a huge market for telemedicine to continue, honestly. And it's interesting because they've been talking about it for years. Because obviously, media is a huge thing these days. And as we've been going forward, it's only going to be pushed even more so because, think of what we're doing right now, right? We're not next to each other. We're doing it through essentially a video or a media standpoint. So it's interesting. It's everything. Like think about it. News interviews are happening like this, yes, or anything. So I think it's really fundamentally changing how we do things. The question is, how long is it going to last? I don't know. But for medicine, it certainly might be an avenue that's going to be certainly opened up and potentially continued in the future. I guess the other big thing though too is just from saying what are we seeing with it? It's basically when people call in, they have to be asked a certain amount of questions. And the idea behind that is, do you have fever, cough, shortness of breath, diarrhea, anything like that? And, the thing is, people can lie at the same time, too. So you're really trying to be the full bulwark of defense. And if they have any of the symptoms, we're putting them into at least at my specific center, we're putting them to a triage room. We're testing them before, we're asking them all these questions. So we're trying to protect the other patients that really have to come through on the front door and aren't able to, do the telemedia or really can't be seen another way. So it's interesting from that standpoint. It's not like anything we would have thought of, prior to all of this. So it's just and to pure selfish reasons, it's a lot more work, because you think it's all the extra paperwork, it's all the extra lab tests you're doing, there's work notes, there's all these types of things. You have to contact the employer, FMLA, because of missing work for these reasons. So it's interesting that everything that's happened, and it's created a lot of extra things that you don't really think that you're going to be, I never thought, or lots of people didn't think of that would be happening at this point in our lives. So yeah. Hopefully that answered some of those questions. But
yeah, for sure. And I would definitely like to reiterate that my agreement with the telemedicine, because in fact I've had two experiences with that where like I've needed a prescription renewed, and we did it all over the telephone, which was, in my opinion, it's sort of like a no-brainer, and we're in such a unprecedented state that I don't think that would have been thought of unless the pandemic had came about, or at least it would have taken many years before that would have been like the new norm. We've sort of been pushed into this sort of situation where we've had to like say keep people safe and re-strategize. How should I say? You said it with the risk assessment, kind of like figure out who would be less of a risk to come in. So
right, exactly.
It's incredible to me, and even for doing video messaging for like mental health as well. Like I've experienced that as well. I used it with BetterHelp, and I needed something, a personal issue of mine, and that definitely helped and was safe, and I felt comfortable with that because trying to get going out during this time is very, very dangerous, and you want to minimize that as much as possible. But unfortunately, it's not something that you can totally you can't disengage with the outside world, because you need food, you need to some of us need to go to work as well. So in that regard, how has that affected your life personally?
Yeah, it's interesting because you're right. You still need food. I mean, there's obviously if you feel like paying more for someone to come and drop it off or whatever, but there's even options too locally if you don't even want to go to the stores. Some of the stores have the drop off kind of areas and stuff like Walmart, Hannaford, things like that. So if people feel inclined to do it, and I obviously encourage it, so you're less risk, especially for older individuals to do it. Myself, you know, I try and go grocery shop or anything like that every couple of weeks, so risk is minimized and kind of buy in bulk from that standpoint. Not that I'm buying 50 reams of toilet paper, but it's more like like, well, what do we need for 2 weeks, and let's just go there because there's been studies that are showing that public spaces, including grocery stores, are one of the highest spreaders potentially of these things or of coronavirus in general. So I think people definitely things people need to do, totally understand it. And, if people are following protocols, that's correct. But I'm sure as well as I do that when you go out and you get food or anything else, that there's a bunch of people, or at least a decent amount of people who don't quite follow the rules, unfortunately, which kind of ruins it and makes it unsafe for other people.
Yeah, exactly. And that sort of it's frustrating in a way, especially because like you're setting the example because you are in the public eye, being a doctor, you have to set an example for the community, and
Right.
it's unfortunate because you're more under a microscope rather than like somebody who is not in the public eye, who's just another member of the community, and like it. I mean, like how what does that make you feel like when you're trying so hard to follow the rules that are set by the government? Because um, the government mandated rules on the coronavirus is it's very hard for them to know what is right and what is wrong because this is very unprecedented. I mean, like we've had pandemics and outbreaks before with like the Spanish flu, but nothing on such a global scale. And
Right.
like they can only do so much as well to keep people safe. And um, at the same time, we also had like I we also had quite a stammer in the direction of where this should go. And so having said that, what do you feel like when you see people out and about and they they like, I mean, like it's kind of like, so some people could be doing it without thinking, and like you know what I mean, like they could just like maybe it just slips over their nose slipping over their mask, like it could be just for like a moment they put it back, but like how does it make you feel when people are determined not to, or to go against the government mandated regulations?
Yeah, it's a good question. Like anybody, I have a healthy skepticism of government to some degree, right? Your question is, are they doing the best for you, or not? But something like this is a different type of a thing. It's not like paying the amount of taxes and raising that or your tax bracket kind of stuff. This is some serious things that I think people don't maybe fully understand. And part of the problem is there's lots of misinformation out there.
Yeah.
And I guess one of the things that unfortunately kind of screwed things up at first was you heard from people, even Dr. Fauci and other government officials, like you don't need to wear masks, right? And that was at the beginning of everything. So then you tell people after a couple weeks, oh, you need to wear a mask now. They're kind of already conflicted because they're like, well, what do you mean?
Yeah.
And what were you telling us before? And people who are already skeptical of government, no matter on what side of the aisle are, they're already kind of like, something's funky, right? So whether I'm not saying everybody conspiracy theorists, but people were like, well, what's really going on? Do we really need this? Is this real? And if you're already worried that government's going to take over, and then you start getting told these things, like you can't go out in public, or you need to avoid these things, you need to wear this, you can't do this, you can't do that. People are, and to some degree, understandably so, going to be frustrated by that. And but the problem was we didn't really have a great unified front in saying this is why we're doing it. Now, Fauci had said originally that's why they were saying it, because they wanted to preserve protective equipment for healthcare personnel. And I think it would have been better, and I understand why they did it too, right? Because you don't want to create mass panic. And the other thing is that I think they were just honest from the beginning, like, look, you know what, we got this thing happening. It could be really dangerous. We want everybody to be okay, but in the meantime, this is what the problem is. We need to save it for the medical community. or I think if they had just said that, it would have gone over well, and there would have been probably less skepticism. Even when I heard those things, it's like, why wouldn't we tell people to wear a mask? To me, it was just a little bit confusing. I understand why they did it, but then I understand why people too are like, well, this isn't real, and this is, so
Yeah.
I get why they feel like that. But the problem is now we know that this is the problem, and it's no longer it shouldn't be a political issue, I guess, is the problem, and it has been made so. And so that's the other half of the problem. Is first you already have people who are already skeptical of things from the government when you're hearing conflicting information, and then you get into the political spectrum of things, where it's been so polarized to the point where basically this is an infringement on your freedom of rights to have to wear a mask or whatnot, versus the interest of public safety. And there's a fine line between telling people what they can and can't do. And I understand people's frustrations. Look, a good example: you're telling people, going out and protesting, and that's a healthy form of expression. And then you're telling people that they can't go to church, right? So people who are church going are going to take that as an insult to really what's important to them. And I understand that to some degree. It's religious myself, but at the same time, you're saying it's a ventilated area versus an enclosed area with not good ventilation. So, but there's lots of factors. But the problem is, I don't think there's really been any consistency in what, at least for the most part, from the prior administration to some degree, about saying, like, why is this important? Why is this safe? Why wouldn't this be safe? And I think there's a lot of the shortcomings came from that, and a lot of misinformation from it too. So I do understand why people do what they do. And the other thing is, you can't make anybody do anything that they don't want to do, and that's from that standpoint, at least to some degree. And I think that unfortunately has created this politicized country that we live in, where people just are kind of non-adherent to rules based off of those principles. And the reality is that when you have a bunch of people too, local business owners or gyms or anything like that. Look, they've been hemorrhaging money. They're having to fire their employees. They're worried about their livelihoods, and I totally understand that as well.
Yep.
So it's multiple levels of complexity, unfortunately. And there's no great good answer for it. If we were saying, well, we look for a while, we're like, okay, we shut down everything, and then we wore a mask, and that didn't work. So people are like, well, this doesn't work. And then people are just saying, well, it's going to be gone by summer. Then by summer came, there was a peak. And then people are like, well, by the end of the summer, things are going to get better. Oh, hit the end of the summer, then we got the fall spike, and now we're in winter, and we're over 400,000 deaths. So it's kind of confusing, because like everything that we seem to be trying wasn't fully as effective as we thought. At the same time, though, you did have large groups of people who weren't adhering to those rules, who were having these gatherings, and probably were the spreaders for these events as well. So, unfortunately, would I want everybody to wear a mask in public and social distancing? Yeah, I would. I think that would go a long way. But at the same time, you can't stop those in-home gatherings, which is the reason that we saw with the holidays of why everything did go up. And we all knew it was going to happen. It's just that people do what they want to do. And, even if you're trying to do that, you tell them it's sort of public good is to help your neighbor, help your fellow American. And, people just, you can't force them to do something.
Yeah, because we're social creatures. It's very difficult to not interact with other people. And it's so hard to like go this long with those social distancing and the mask wearing, or just we practically we're coming up a year into this pandemic, and there's still no sign of it going down at the moment. We do have the vaccinations that have come out. You've actually been vaccinated, and I was very proud of you, because you got on the local news and set an example to the community to say, yes, I'm doing this, and I'm excited to get mine, but I know that's probably not going to happen until probably the summer, which is fair dues, because it's a very limited because you got to vaccinate like pretty much the whole population of the United States, the Europe, all over the world. Everyone needs to get this vaccination, so supplies are going to be very limited. And I'm very happy that they're. I mean, at least in England, they have the tiers where it'll be like people of over a certain age group. I believe it's 70, like people over 70, then 65, then it goes down from that. I can look that up. And verify that for information at the end of the stream. So like all frontline workers are definitely getting it, and I'm very happy about that. So with that in mind, that just being vaccinated does not mean that this is the cure. It means like you've been vaccinated and you still need to social distance and maintain wearing a mask and washing your hands as much as possible.
That's unfortunately, I think, an overlooked topic. I think people think that once they're vaccinated, they're fine. They might be okay, but the thing is, you can still transmit it to other people, but potentially here. And the thing is, we don't have any long-term data on all of this, right? We've had COVID for a year. So in retrospect, maybe we'll be able to look back and be like, oh, we should have done this, or this is why this happened. But the idea here is that, number one, we do need to have enough people to actually get vaccinated to be able to help with this. And the problem is, you look at this, we're a global, global economy, or globalized world. So the question is, if we just we just do ourselves, like, look, UK, Europe, us, vaccinated, Israel, all the countries that really have lots of vaccinations, or Russia, China, but that really are spreading giving out the vaccines. But the issue is, if not everybody in all these other countries have been vaccinated to the appropriate amount, it's still going to continue to spread. So the question is, how long is this going to go on? And the question really is, it doesn't look like it's just dying out by itself. And the other thing is, how much are we going to need to make to create worldwide immunity? It's questions we don't have the answers to. Yeah. So maybe the United States or Europe and England be okay in the next year after we vaccinate. Maybe. At the same time, we don't know, because then there could be, and with any virus, look at the flu virus. You get the flu shot, you can still get the flu. It does lessen the the side effects, which is why we definitely encourage people to get so. But the idea here with COVID, it's much more dangerous and certainly more deadly. And then you have the other idea with any type of virus, it mutates. And look how many times this has been going around the world. There are different strains we're finding. You're finding the ones in even England or South Africa. They're saying they're mutating more to the point where they might be resistant even to these vaccines that just came out in the last couple of months. And that's a kind of almost feels like, oh, geez, what the heck is the point of these vaccines if they're not going to work? Now, the reality is they're not saying that these new genetics changes in the vaccine, or not vaccine, but the viruses themselves in those two areas are more deadly, but they may be more resistant to even some of the treatments that we have. And they're certainly more transmissible. And one of the problems I think people don't understand with coronavirus, or at least there's not really reported out in the public, is it's not just like the flu and corona are different from spread. You have more of the droplet precautions with flu. And with COVID, it's been a talked about thing actually for quite some time, several months. And the possibility, and even the CDC is recently posting potentially the idea of aerosols spread. So that's actually it's more of the very small particles that actually linger in the air for periods of time. So say like you go to a restaurant with a group of people, right? And you think you're all fine, but for an hour before, somebody else was just sitting in that area that potentially had COVID, asymptomatic, and the aerosols are kind of just sitting in there, and you don't have a good ventilation system. Yep. So they could be settling down and spreading. You could be inhaling those particles potentially. So it's not just, it's things we don't even, someone might not even think about of a transmission risk, but it still does evolve. And I guess I'm getting a little off topic from the idea behind vaccination and stuff, but it's even not just, even if you get vaccinated, it's all these other things like, okay, well, some areas of the world could be vaccinated, but not the other areas. Versus, if there's genetic changes in this thing that become resistant to vaccines, what happens? There's, a bunch of different vaccinations coming through in the pipeline that could even be one shot, or different like modes of distribution, mRNA vaccines versus like a live de-attenuated or kind of a weakened virus, or even other ones. And it's interesting because we'll probably the reality is how many. We have a COVID shot now, and they say the immunity lasts for 3 or 4 months, but that was also the study. Does it last longer? Does it taper off? Probably to some degree, just like a flu shot, right? You say that good for us 6 months of the flu shot. The question is, if you only have 3 to 4 months of immunity here, do you have to get almost like a twice yearly COVID shot to kind of help protect the population or something else? Yeah. Answers, we don't have. And the question is with vaccine, I guess just making the vaccine and distribution of the vaccine are the two hurdles that we have to place. As well, because like I said, the world versus just more, say, I guess first world countries, that's a whole different problem. And unfortunately, lots of areas too, that maybe have less, I guess what the word I'm looking for is less established healthcare systems or less access to things, unfortunately might suffer. But even look at a first world country like the United States or even England, and we're having all these deaths. It's interesting. And the question is, I think no scientist can say exactly how long this is going to last. I think we easily, at least all can say, it's probably easily another year, which makes things rather frustrating. But after that, we don't know. And might this virus just die out? Does this virus? We hope, but there's no. It doesn't seem to seem like that case either. Or is this virus just going to kind of be something we live with on a regular basis from now on? We don't have the answers for that, but. The best things we can do is to social distance things, best that we can, still wearing the mask appropriate, which is over the nose, closed, so there's no aerosols kind of going up. But like, there's no great answer, unfortunately. We're still learning stuff about this, now. It seems like every time you turn around, you're hearing new information or new things that you're thinking about from this stuff. So we're living. It's interesting now too, as I'm talking to patients, like we're living in history as it is. Think about it. They talk about the Spanish flu. In 100 years, they're going to sit there and be like, they're going to talk about COVID. It's kind of funny. We're actually living this stuff, and we think it's stuff in the history books we don't think about. But I don't. We're much more globalized than we were back in 1917 and everything like that, around the time of the Spanish flu, roughly. But now. Since everything is such a market-based economies and capitalization and moving things around and people visiting every other places, it's just wreaked havoc on everything. So the great answer is we don't know. Unfortunately, we all hope that it gets better and that people would agree to get vaccinated. But the rate of which and the amount of people who will, unfortunately, we can't really say how that will fully happen or when it will happen.
Yeah, unfortunately, we're in that sort of situation where it's like time will tell what's going to happen. But you are I completely agree with the fact the world is a lot smaller than it was in 1917. You can say, and with social media all over the place, misinformation is very, very. It's something that's going to be inevitable, and
right.
The best thing that everyone can do is definitely to keep on wearing your mask, social distancing, and trying to get the vaccinations. And we can only really hope what's going to happen down the line, but at least we can take these preventative measures to minimize it as much as possible. So having said all that and putting everyone in a very bad mood, let's talk about what you have been doing to stay sane during this pandemic, because, we're not able to travel. Like, I haven't been back to England in going on 2 years, and that's a big heartbreak for me. But it's something that, like, in comparison to, like, people's lives, that's nothing. Like, but at the same time, you got to keep your spirits up a little bit.
Right.
So.
Well, yeah, it's frustrating I get it. Young, healthy, you want to go and do things. We were finally going to go and travel somewhere, and then coronavirus hit and we don't. It's like, I finally got at med school and residency. I have time and more money, obviously, than I had before. And it's like, I want to go do something, and we can't. So I share everybody's frustrations because I want to do the same darn things too. And you're right. And I guess socialization is a big a big problem too that we've had. We're seeing lots of anxiety, depression issues in my office, and I'm sure across the country because of the lack of that. And how do you mitigate that? That's difficult because some people really want to be by other people, and unfortunately, that's probably led to the spread of the holidays.
Yes.
Other people, like myself, saying, we do these things like Discord or Play Along or things like that. You're calling people or Skyping or whatever with your family. That things we do have to do to keep. We're social creatures by some degree, at least for the most part.
Yeah.
For you need some socialization usually. So that's part of the issue as well. And finding things that you can do, pick up a skill or a hobby or become more physically active. Go out. I think maybe one good thing about this is people potentially appreciate nature and go outside more, rather than sitting in front of the TV or just, stuff like that. Maybe. But, I found I had done several hiking trips over, during the fall, which is great in the Adirondacks. or even, whatever else, going outside from that standpoint, I think is important because it kind of it gives you something, and obviously any physical activity makes you feel better. So people are already having problems with anxiety, depression, maybe getting back, work on their health could potentially help. But the question really is, from the fact of feeling isolated, that's another whole problem. Yep. And I think for everybody the answer might be slightly different. And so if that is, more frequent Skyping issues, or even meeting in a public place outside, appropriately, I have no problems with any of those things. It's the private gatherings where you're close contact with no precautions is unfortunately what keeps leading to these things. But I do understand people's reasons to want to do those things, and I want to as well. But I can't be hypocritical and tell my patients not to do these things, or advise the public not to if I'm not going to do them myself. Yeah. For example, like the last year, all the pretty much birthdays in my entire family since February, or like my anniversary or Fabi and I. Or even the holidays, anything, Thanksgiving, Christmas, New Year's, we didn't go anywhere. We didn't do anything. We didn't have people over. It's frustrating. It sucks because, those are the few times a year you feel like, well, there's some camaraderie. You can get together or celebrate something good. That feels like it's kind of taken away from you, and not just myself, but a lot of other people as well. And then the other problem is spreading it to other people. If you're worried about that, especially my grandparents are 90s, I don't want to spread anything to them. I feel horrible. So, trying to contact them. We would go outside of their apartment and talk to them through the window, kind of thing. And so it's definitely not the same. It's actually really frustrating, but at least it is something. And the other issue is people are talking about not just mental health, but even to our seniors. People talking with people in nursing homes. And those are probably one of the not as much lesser talked about, but things that we don't think about quite as much, because they're shuttled away in these facilities. They're not allowed to have contact. Maybe they're somewhat spread or changed guidelines recently, maybe very small amounts, but probably not given these increased cases over the last winter time. But say somebody who's already feels isolated, they had to leave their house, they got thrown into this nursing home, they don't know who the people are, and then now they can't have contact with their regular family members. So it's really bad. And people have memory issues. They need that mental stimulation, they need those reminders, they need those types of things. So unfortunately, I think for example, my own grandfather, I could see him kind of start spiraling a little downward because of the lack of socialization, unfortunately. From this, and that's not a unique case, and he's not even as bad as people in nursing homes. So it's unfortunately a thing that is affecting lots of people in society. I guess the safest thing to do, like I said, it's hard to say outdoor gatherings where you're still kind of I guess it's hard in the wintertime for sure. Yeah. Outdoor gatherings, where you're properly distanced and wearing a mask would be obviously the idealized thing. But like I said, other than that, using social media or technology like this, like we're doing right now, is at least another avenue for that. If you feel it's a higher risk issue where you just feel safer that way, that's something to do too. And I don't know, I'm assuming you've probably done the same thing with your family and probably across the pond as well, too, because there's no other, you can't, what else can you do, right?
Yeah, exactly. In fact, I've actually reached out to people who I wouldn't have normally done in such situations. Like I've managed to create new connections with people across the globe via common interests, and it's worked out so well, and they are very lovely people, and we're all in this together. We're our young lives, our adventure days, are sort of put on pause, and it's not just us. Yeah. So anyone who is struggling, first of all, I highly encourage you all to get to look after yourselves and reach out for help when you need it, because help is out there available to you, and it is one of the best decisions to do. And sometimes asking for help is the hardest thing, but I applaud you for wanting to reach out. I will say though that interacting with people via social media, even just playing simple games, it has really kept me going. So
Yeah, no, it's hard. I think everybody's different. Some people are less social creatures than others, and maybe they need a lot less of that. And this might not be impacting them as much, but at the same time, you need something at the end of the day. And like you're saying, reaching out, it is important. And the thing is, I think people, mental health has clearly been something that's stigmatized in the past, but I think we all kind of realize that it's a normal thing. Lots of people have it. You go through good days and bad days like anybody else,
Yes.
and this is making it hard. So the amount of people that have come and started talking about anxiety, depression, even as a from my standpoint as a clinician, it's gone up, sure, but at the same time, it's nothing to be ashamed of in any way. It's just, the brain is like anything else. If you're a problem with your heart, you need to go get that checked out. Same thing. You have a problem with mood, anxiety, depression, same issue. So
there's always somebody out there who wants the best for you.
right, and then especially now, telehealth, media, kind of stuff like that is actually another way that, like, you use it yourself. You said that can be, if you don't even feel comfortable going out into public, that's another option for people as well.
All right then. Thank you so much for doing this, David. I really appreciate it. And yeah, let's hope that the cases keep start to tail off, or at least like we mitigate it as much as possible. And yeah, thank you so much for all the work that you are doing and keeping the community healthy as a doctor.
Well, appreciate it, man. Yeah, it's part of the job, but hopefully we'll go in the right direction soon.
Fantastic. Thank you so much, David. All right.
No problem.
And thank you all for watching, and I hope to see you next time. Bye. Hello, I'd like to take this opportunity to amend to the interview that I had just conducted with Dr. David Ellsworth. In it, I had referenced an independent report based upon the distribution of COVID vaccines. The priority groups of the vaccination was from the advice of the JCVI and was published on December 3rd, 2020. This has since been withdrawn on December 30th, 2020. I will put a link in the description for this independent report, as well as the New York State government site for information upon the COVID vaccine distribution. My advice for all of you is to stay well informed, and if you are eligible, find out that you're eligible and get the jab as soon as possible. Anyway, thank you all for watching, and I hope you enjoyed.